I've been Jarle Rode, CEO at the World Heart Federation. Thank you so much again for joining us today. Ahead of the upcoming Global Health Expedition 2025, we're so excited to have you join us as an esteemed speaker. As you know, the theme for the conference this year is Invest in Health, which can mean so many things. I would love to know your point of view. What does investing in health mean to you?
Thank you so much, and thank you for welcoming me. I'm very happy to speak to you and also to come back to Riyadh this year, as I was last year. I think investment in health is of crucial understanding these days. It's a global issue. It's a regional issue, national and local issue. We have grappled with health financing for years, since back to the Second World War, and the diversity of the world today is enormous. The quality of health investment is extremely different compared to where you live and where you grow up. It's unfair, unequitable, and it's impossible to support under universal health coverage, the strategy from WHO, to really support equitable all people around the world. The problem is that we invest and finance sick people. We don't prevent, we don't preempt what's happening tomorrow. I think we can learn from other areas into global investment and see that prevention today avoids spending 10 times tomorrow. And I think that's where we go wrong. That's where we see, let's say, the last couple of years, we see official development aid shrinking. We see more high net worth individual investing in health from a personal point of view. So we are not necessarily directed to where we want to go strategically. We are directed more individually, and it's, let's say, the powerhouse is taken away from governments to individuals, to corporate, to organizations with self-interest. This is not a good development for health investment. It's bound to be sitting with each country. It's bound to be resource mobilized in each country. But we have responsibility globally to support and help where it's needed. It's needed in low and middle income country, and we see the sort of discrepancy from these countries to the wealthy countries are increasing. That is the biggest problem that we have today, and it cannot be prevented if we continue as we have done so far. We have to change the mentality, we have to change the focus and change the understanding, the basic understanding of health investment. It goes back to the individual. The out-of-pocket cost can be enormous for families in low and middle income country. This is the biggest problem we have. And this is where we have to put in strategy, wise investment, and coordinated approach globally.
Thank you so much. That's really interesting. It's really important for us to bring together diverse voices from across the globe to offer different perspectives at the event. I know you get invited to lots of different conferences. So what is it about Saudi's Global Health Expedition that stood out to you and inspired you to travel from across the world to take part in this event?
I think number one is for me the region, the interest of the region and the approach of the region that has been below the radar for many years. We haven't really appreciated what has been done in the region, investment of new technology, and very early on stages of supporting and minimizing different diseases. I started to work with Saudi Arabia specifically for 20 years ago, long before there was a line of people coming to Riyadh or any other parts of that region. And I've seen the enormous development, the enormous interest of the leadership, the governments, of the different countries in that regions to invest wisely in health. I saw when I came to the exhibition last year the innovative approach of the exhibition. For me, that was very vital and very important. There were so many different new corporate and companies I've never met before in my part of the world, which is Europe, and that sort of diversity and dynamics really made interesting change for me to be part of this sort of new initiative. And I'm so happy to come back and see that thousands of people coming to this exhibition all over the world from different parts of trade and functions, doctors, professors, engineers, and you name it. I really look forward to come back, and I really think that the sort of dialogue that you can have in these conferences are so vital and so important because they have the presence of the Ministry of Public Health in Saudi are in the conference during the entire week of the conference, and you can have that political, systematical, and financial dialogue constantly during the days at very high level. So for me, that is a given to be back, and I'm very happy to be invited back as a speaker.
Well, we're certainly very excited to be having you back. And we're really excited as well to be bringing together so many different nationalities and specialities together for the show. What do you see as the importance behind global collaboration in shaping the future of global health?
Today is more imminent and urgent than ever before. We know what happened the last year, but I think that what happened with official development aid, ODA, which is the largest sort of contribution worldwide, globally, of interaction between government. That's where you find the highest amount of money. If you look at the humanitarian side, development side, it's like 10%. The government's 90%. The divide is enormous, and you have to have a dialogue between these actors to find that global coordination. If we look at UN today, we know it's hard to use the word, but close to collapsing. We know they look into themselves and see what they could do with much lesser means in the future, much lesser opportunity to do exactly what they've said they want to do. And under this comes WHO, one of the most hardest affected organizations for the downscaling of ODA, will really have to re-emerge as a different new organization to be sure they can continue to work globally with all the actors that are part of this work into not only investment of health, but strategizing the world to develop a better structure in country today, to have less diseases, less burden of diseases, and less numbers of sick people that will affect your GNP all over the world. I think the global coordination is, it's an open door. We all understand it. What we don't seem to understand is how we do it. What do we do today in a new world with new type of funding? How do we resituate ourselves to be sure we meet the needs of the future? I think it's very challenging. I have many good solutions, but it's part is political and part is functional and financial. The money are always there, they're always around, but it's who takes the money, who takes the funding, and what do you do with it? If you don't have a global lead, you will never have the effect that you could have had of the money that you're receiving. So I think that the upcoming UNGA is very important. I think countries are carefully treading water to sign up for new resolutions because a resolution costs money, and countries are today aware of who will actually be funding these resolutions. But we can't step back and give up. We have to fight and say, no, guys, it's needed, and understand where your development funding comes to best use. I think that is the global approach. It needs to be not as before, but resituated in a more country-focused approach than what we have seen in the past. We said this in the humanitarian summit in Istanbul, I think it was in 2016 or 17. What have we done? Very little so far. So, as said by many people before, time for action, no talks.
Thank you. And I understand you're working on an initiative at the moment called City Heartbeat Index to track health statistics at city level and not just at national level. And Riyadh is on your list of cities to include. Could you tell us a bit more about this work?
So as part of the work for the World Heart Federation, an organization based in Geneva with partners all over the world, members globally from individuals to big organization working on cardiovascular health. We want to have this index. It's very new, it's very in the start, because what you can find in today's national indexes or country-wide indexes, we are looking into with different partners in research and other areas of work, how we can find this sort of the same numbers for the big cities in the world. Why? Because the big cities are growing day by day. More and more people live in city. And it's the City Heartbeat Index goes every way from how you build a city, how you develop your housing, how you build your roads, have you access for pedestrian, for bicycles, for electrical movement, have you planned the city for no fossil fuel. All these sort of individual things are important when you look into a city. And it's not like it needs to be a new city. It can be any given city in the world today that can sort of go back and say, this we can easily invest in. This is like a very easy takedown immediately, which will help the individuals living in the city for better health. And that is the main purpose. And that is the interest of many partners to sort of build up this index to a global sort of accessible activity that everybody can go in and see, and the score for each of the cities. We are working together with the mayors of all the cities around the world. They have their own organization, and they come forward to me and raise their interest to be part of this. So I think it's a great initiative. I think it's a great discussion for Saudi Arabia because they have the strategy 2030. They have great vision for the future. And these are the type of countries and cities that we want to work with the next 5 years to establish this groundwork and then to evolve from that into as many cities as possible globally.
Sounds like such a great initiative. We'd really love to hear about your session and what people can expect from that global health expedition this year. So if you could share some light on that, that would be great.
I want to come to Riyadh and engage with as many people as possible. Of course, as a speaker, you can do that more easily. I want to engage people on the financial side. I'm not a doctor. My background is in finance, and I think I can add value to the more sort of fuller understanding of health initiative, of the cost, and more important, what you save by doing the right thing. So I think that will be my highlights in my speak, to focus a little bit on number, not so much on the disease, but what health can give countries instead of waiting and see what happens if you don't do anything. That's the norm of the world, unfortunately. We don't react until our feet are wet. And I think we need to think differently. Tomorrow, we don't have that luxury of sitting and waiting. We need to think differently. There's so many diseases that are really coming up to bite us all over the world because the numbers are getting higher and higher. If we don't prevent, we will lose in time what we want to do globally today.
Thank you so much, Jarle Rode. It's been great to speak to you, and we're really looking forward to having you with us this year.